Every minute, health information is updated and increasing. There is a seemingly endless amount of information on health. But how do we know where to look for the information we need and whether it is accurate? How do we get the right information at the right time into the hands of decision makers who need it most? If information is not available, or if it is not managed and used properly, what are the consequences?
It's impossible to imagine how a country can effectively manage either individual health consultations or financing systems or drug supplies without a strong information system. So both private health, individual health, and public health depend completely on an effective information system.
Health information comes from two major sources, population-based and institution-based. But how do we optimize the use of these data to achieve the goal of better information, better decisions, better health? Countries have used individual and varied approaches to develop their health information systems. There are some good examples of how country health information systems have had a positive impact on the health and lives of their people. Villagers in Rufiji and Morogoro regions of Tanzania are familiar with the scene of local health officials on their bicycles, visiting each household, collecting and recording data on health, pregnancy, birth and death as part of Demographic Surveillance Systems or DSS. Thanks to the Tanzanian Essential Health Intervention Project, a cooperative project between the Ministry of Public Health of Tanzania and the International Development Research Centre from Canada, the collection and use of these data is directly impacting the lives of the people. This project enables health budgets to be allocated according to the type and severity of disease in the area, instead of a general budget line from the central government. Data collected through the DSS, especially records on the cause of death, mean that critical health needs can be identified and resources can be targeted according to the highest priority. One example is the increased budget for malaria, a disease that claims the life of more Tanzanians than any other single disease. Accordingly, the budget allocation for prevention and treatment of malaria has risen from 5 to 25%. The high rates of mortality among children under 5 also led to a higher allocation of budget to support the management of childhood illnesses and advice to mothers. Over a 5-year period, the mortality rate of children in the two regions fell by 40%. The use of data from DSS has provided the information upon which to make rational budgeting decisions, and as a result, villages in the two test regions are in better health. Pasay City in the Philippines provides an example of the problems often found in developing countries: insufficient medical services, manual filing systems, and health workers spending too much time filing and compiling reports.
We're trying to systematize the production of health information, limiting the number of indicators that we really need and not burden service providers in collecting, but at the same time they don't use it.
So here in Pasay City, also we want also to be, keep abreast with the modern technology. That's why we're trying to computerize our health centers through cheats.
The Community Health Information Tracking Systems, or CHITS, uses free open-source software for the collection of health data from health centers. It is a computerized system, a tool to help health workers do their jobs. Patient data is recorded for doctors or nurses to check on patients' medical records. Key information on adverse drug reaction, for example, means that patients are safer due to better care. The Community Health Information Tracking Systems also facilitate weekly and monthly processing of data so that reports can be quickly presented to the Department of Health.
The health workers have more time to see patients, to follow up patients in the community. So I guess that that would lead to better health outcomes.
Because the ultimate goal here is to give good service, and it's very rewarding for us if they are satisfied for what you are giving to them.
The health center of Ang Thong and Supanburi in Thailand combine high-tech and human data collection methods that lead to better health for the people in the community. Pocket PCs always accompany officials from the Tambon Bang Chao Cha Health Center when conducting health surveys in the community. This small gadget contains data such as patients' personal data, records of adverse drug reaction, and upcoming appointments. These electronic handsets are more convenient than the traditional paper filing systems that were used in the past.
การใช้กระดาษหรือใช้โฟลเดอร์ต่างๆเนี่ยเราต้องใช้วิธีการเขียนซึ่งมันก็เสียเวลามันจะช้าส่วนหนึ่งอีกส่วนหนึ่งก็คือข้อมูลอาจจะขาดหายได้
After the visit, officials can take out the memory card and load the data into a PC without having to key the data in again. The number of patient visits has increased from 2 or 3 to 4 or 5 a day. Patient follow-up for those with chronic diseases is more thorough and comprehensive, while administrators can check and process the data more quickly.
เราก็จะรู้ว่าในแต่ละวันเนี่ยแต่ละแห่งหน่วยบริการเนี่ยไปทำงานได้ก้าวหน้าสักเท่าไหร่ทั้งเกิดประโยชน์กับผู้ป่วยที่ได้รู้ว่าข้อมูลเขาเองได้นำมาครบถ้วน
On the contrary, at the Tambon Wang Nam Yen Health Center in Supanburi, local volunteer health workers, not gadgets, provide the key to sound data collection and management in the community. Health center officials prepare simple patient follow-up tables for volunteers to complete on each visit. As a result, the data collected are accurate and reliable.
ใครย้ายเข้าใครตายอะไรพวกนี้คือข้อมูลตรงนี้เขาจะรายงานให้เราทราบ
With volunteer village health workers acting as data collectors, they know the real problems in the villages. They are ready and equipped to help solve problems and prevent disease so that the people in the community can enjoy better health. Both the Pocket PC and the human factor show that access and flow from data sources not only yields good data, but also forms disease monitoring systems, so that prevention planning can be done quickly and effectively.
ระบบข้อมูลที่ดีมันนำมาซึ่งการแก้ไขและพัฒนาสุขภาพที่ดีได้อย่างฉับไวและทันท่วงที
Where public health is concerned, the difference between good decisions and poor decisions can mean the difference between life and death. Good decisions depend on sound information. Join us to achieve our shared goal. Better information, better decisions, better health for all.